I'm Alice Barsoumian, and I'm one of the infectious disease physicians here at BAMC. Welcome back to Friday Facts. Dr. Markels is unable to join us today because she's doing some stuff on the inpatient clinical side. But I do have two other guests. They're returning guests from last year's Antibiotic Stewardship Week. And we have Dr. Kayla Scheps, our infectious disease pharmacist, and Dr. David Lindholm, our infectious disease physician. And they are the chairs of the BAMC Antibiotic Stewardship Committee. All right, well, Dr. Lindholm, Dr. Scheps, what did you want to come on and share with us today?
We just want to let everyone be aware that this upcoming Friday, which will be today through the 24th, is Antibiotic Awareness Week. So what does that mean? Every year, not only in the United States, but worldwide, we celebrate appropriate use of antibiotics. As we all know, antibiotics are used for bacterial infections. So common infections that you may have, like viral infections, don't work when we use antibiotics. So for us, we are trying to promote appropriate antibiotic use within our patient population so patients don't have any adverse reactions. So when antibiotics are used inappropriately, unfortunately, there are some bad outcomes. Just in general, there's over 3 million multi-drug resistant infections that can lead up to about 35,000 deaths each year. So with this, we want to improve antibiotic use. So things for viral infections, we don't want to use antibiotics for. Dr. Lindholm, you have some statistics with inappropriate antibiotic use in the outpatient setting?
Absolutely. So yeah, antibiotics are very common, as Dr. Scheps was saying. About 1 in 5 outpatient visits end up with an antibiotic prescription, and about half of all inpatient admissions end up with an antibiotic prescription. Unfortunately, the data would show that about 30% of antibiotics are either unnecessary or inappropriate. So unnecessary meaning that it was for the wrong indication, so maybe it was actually a virus and they didn't actually need an antibiotic, or inappropriate, maybe too long of a duration, or the wrong antibiotic was chosen, or the wrong dose. And for some conditions, so overall about 30% are inappropriate or unnecessary, but for some conditions like upper respiratory infections, colds, sinusitis, otitis media, ear infections, things along those lines, about 50% of antibiotics that are prescribed are unnecessary, and that's because many of those are actually caused by viruses. So most colds, most sinus infections, most cases of sore throat, bronchitis, chest cold, those are typically viral infections that don't actually require an antibiotic. And sometimes physicians and patients might just think, hey, let's just be safe and give you an antibiotic just in case, but often that just leads to adverse events.
So one of those adverse events is that bacteria becoming resistant to that antibiotic. So what does that mean? That means if you try to use the same antibiotic later down the road, it might not work for your infection. So the provider will have to pick a different antibiotic. And with increased inappropriate use of antibiotics may make it harder to treat infections later down the road. Other things that we need to consider as well is adverse events. So things like GI upset, patients might experience nausea, vomiting, diarrhea with antibiotics, or potentially have reactions like a rash or even potentially worse, anaphylaxis. So it's always great to ask your provider, why are you prescribing me antibiotics, and to advocate for your health.
Yeah, I think it's important to know. I certainly have struggled to treat some drug-resistant infections in my patients. And one of the things I've noticed is that the more and more antibiotics they have, sometimes they're not able to have any kind of response to an oral medication and would have to be admitted to get intravenous medication for these infections. So point well taken. You mentioned colds, Dr. Lindholm. So I noticed that there is some national data that with COVID, that outpatient antibiotic prescribing for colds has decreased. So I think that's a heartening sign. Do you have any recommendations for how people should take care of themselves when they are feeling an upper respiratory tract infection?
Yeah, definitely. So a lot of supportive care. So making sure you have a lot of fluids. You can ask your pharmacist over at CVS or Walgreens or even here at BAMC regarding supportive therapy, so like decongestants, as well as antihistamines like Benadryl to help with some of the runny nose, fevers, and muscle aches.
And I love asking somebody too to make sure there are no interactions with any different drugs that they may be on.
Absolutely. And I think another thing is also to remember that we are entering into a season where we've got rates of COVID currently are relatively low, but it's still out there. So there are treatments available for folks who are at risk for progressing to severe disease if they have COVID. and so I think still getting tested if there's concern, and also we've seen nationally a lot of increase in rates for influenza really early in the season, and respiratory syncytial virus, and which is RSV, if you've heard that in the news. There's not a treatment for RSV, but there are some cases where it's appropriate to treat for flu. And so I think if there is concern, testing for COVID and testing for flu can also be important, because that may actually change not only isolation practices, but potentially also treatment.
And I would like to make a pitch for some vaccinations too. It's the holidays time to keep yourself healthy and able to engage with your relatives over the holidays. I always recommend for a seasonal flu shot, and now the new COVID bivalent booster. You can get those here at the MTF, or you can get them on the economy for adults and for children. All right, guys, so do you guys have any big holiday plans coming up for Thanksgiving week? Oh, I mean antibiotic stewardship.
Of course.
For both. A lot of turkey come Thanksgiving, but for antibiotic week, we have a lot of fun things within BAMC. We have an antibiotic emoji game. So we are using emojis to help people guess what antibiotic is within that emoji. Also, we're going to have some free continuing education links for our healthcare workers, as well as some links to the CDC website regarding appropriate antibiotic use and how you can advocate for your health.
I like that CE. That's a great addition to this week.
Absolutely.
Yeah. Well, I plan to eat all the turkey. I love turkey, and it's such a pain to cook. You only get it once a year. But I think that I will have to do better about incorporating more big turkeys into my yearly menu. It's probably not going to happen. All right, everybody. Well, have a wonderful Thanksgiving. Stay safe during this holiday season, and be on the lookout for our antibiotic stewardship efforts and activities as a beneficiary and also as an employee here. Take care. All right, so we didn't want to leave on that note. We wanted to make sure that we got our Planksgiving challenge in.
Make sure to post all your planks on social media at BAMC.
Happy Thanksgiving.
Happy Planksgiving. I'm just going to keep filming until we all collapse.